In terms of technologies that are associated with pregnancy and fertility, the main ones that need to be understood are numbered 1, 2, 8, 9, and 10, but the other ones are related and they're still important for understanding. Fertility drugs can be used to increase follicle production in males and females. Depending on the reason, there's a few options that can be performed. Drugs that inhibit the conversion of testosterone to other hormones, because that happens in our body, there's binding proteins that will pull some of these hormones out of action, could be administered to increase testosterone. So if we prevent the conversion of testosterone to another substance, that's going to thereby increase the concentration of testosterone. HCG can be used, or clomiphene citrate injections, and they both have the effect of increasing testosterone and therefore sperm production. So if low sperm production is, not is more of a hormonal thing, maybe not a physiological issue, that might be an option for fertility. In terms of women, clomiphene citrate can also be used, which will end up stimulating the production of more ova, or gonadotropins like FSH, or one called human menopausal gonadotropin to stimulate follicle development. In vitro fertilization is a process that tends to be done after a few other options may have been exhausted already. So in vitro fertilization, the ovary is hyperstimulated by hormones that would increase follicle development. And so the woman is going to be producing a lot of follicles, and those follicles will be withdrawn. So they don't want to do one at a time just because of the complexity of this procedure. By hyperstimulating, they're going to hyperstimulate with one of the medications we talked about above, and there'll be a whole bunch of follicles that are going to form from it. And then those ova are going to be removed through that image in number 2. So the transvaginal oocyte retrieval. So it goes through the vagina, but kind of goes along the side rather than through the uterus. And the mature ova are aspirated out. Those mature ova then are placed into a petri dish as a best example, and are allowed to be in the presence of sperm. In many cases now, they take the sperm sample and they inject the sperm directly into each one of those ova. And then they let those zygotes sit for a while and see how they develop. They'll take 1, 2, or 3, sort of depending on the circumstance, of those now blastocysts and transfer them back into the uterus of the woman. And in the meantime, the woman will have corpus luteum in those ovaries where those follicles were taken out of. And so she should be producing the hormones and preparing the endometrium to prepare for this potential implantation. And then it's a matter of waiting to see how many, if any, of those blastocysts implant. And of course, the doctors take the healthiest of those blastocysts. So in vitro just means in the lab versus in vivo, which would be in life. An ultrasound is a technique that is done to study hard to reach areas of the body. So there's an image there of a fetal ultrasound, but they'd also use the ultrasound for that oocyte retrieval in vitro fertilization to make sure that they're getting the aspirator onto the ovary, right? It's ways to see into the body. Amniocentesis and chorionic villi sampling are ways to test the cells that are associated with the fetus. So in amniocentesis, a small amount of amniotic fluid is drawn from the amniotic sac using a needle. And you can see there's an ultrasound device on top of there as well. That ultrasound device is just going to ensure that the needle goes into the right location. The amniotic fluid contains cells from the fetus, and then those cells can be drawn and investigated for chromosomal conditions, nervous system disorders, the genetic sex of the child, and so on. It's typically not used just to determine the genetic sex of the child. It is there to determine whether there's any chromosomal abnormalities that the doctors even need to be aware of. For example, when the baby is born, they can have the right critical care team there to help support that baby, confirming a condition. And there's obviously going to be some risk involved because that needle is going to go through the amniotic sac. The amniotic sac does have a bit of a self-healing property, but of course there is risk in terms of that amniotic sac rupturing, because if it ruptures, that baby needs to be born. And if that's too early in the pregnancy, that is not going to end with a good result. Chorionic villi sampling is a less intrusive technology where cells from the chorion, or the kind of the placental area, will be sampled. And because that chorion is, originates upon fertilization, it's comprised of cells of the embryo. Those cells can also be looked for chromosomal conditions, the genetic sex of the child. The conditions aren't going to be as um, detailed as you could get for amniocentesis, but it's still a good option that is less invasive. So catheters inserted into the vagina with a probe that reaches to that chorion area, obviously using an ultrasound to make sure that they get the right area. And then those samples are sent to the lab. Artificial insemination is taking sperm from a live donor and inserting it directly into the uterus around ovulation, or sorry, into the uterus around the cervix around ovulation. So it's achieving a pregnancy by means other than sexual intercourse, and sometimes that's an option as well when it comes to a fertility treatment. Umbilical cords have stem cells, or cells that are still undifferentiated. And sometimes those cells can be used for certain conditions of the blood, like cancers, anemias, lymphomas. And so often people who have a family history of those will be given an option to save the umbilical cord through a company that freezes them and saves them in the event that a bone marrow type transplant needed to happen. 8, 9, and 10, we talked about in the previous pages, and you can see them referred to there. An intrauterine device is a device that's inserted into the uterus. It's T-shaped. It has two functions. It'll block the sperm from going up into the fallopian tubes, block ova from coming down, as well as they most often contain a little bit of progesterone. So that in itself, because that will inhibit FSH, should inhibit ovulation in the first place. So they are a fairly good form of birth control. They last for 3 to 5 years. The only thing is so somebody who is young and planning on having children, or even a woman who's a little bit older planning on having children, that's probably not the best option for them for birth control. Perhaps the birth control pill would be a better option. Castration is the physical removal of the testes, often used as birth control in mammals other than humans. For example, in dogs, it's called neutering. So there are your technologies.